So what did the physical therapy program look like just after injury, right? So I ended up seeing this patient, I want to say 1 or 2 weeks after her initial injury, right? And I basically gave her a lot of repetitions of quad exercises. If you guys are watching this on YouTube, phenomenal. You can see the program right in front of you. Same thing on the video podcast. I'm going to read through this for the folks that are listening to this via the audio podcast. So I basically prescribed 2 sets of 15 to 25 repetitions of each movement, 2 to 3 times a day, and adding light weight as you're able to tolerate it well. Okay. The reason why I do lots and lots and lots of repetitions is because we're trying to restore neuromuscular control. Okay. So that quad does not fire really well after this initial injury. So the analogy I give my patients is that if you want to be a really good painter, you have to get a lot of reps in. Okay. You're building that motor control of being a better painter. Okay. So if you paint for hours and hours and hours every day, you're going to be a lot better at painting long term than someone that does, let's say, 2 hours, twice a week, right? So I think early on, we're not doing strictly strength training. We're trying to build neuromuscular control. So I favor a lot of repetitions. The other reason why I favor a lot of repetitions is because I want to start blood flow restriction training soon. Okay. And when you do BFR, you generally do it with high reps. But I want to make sure that a patient can tolerate high repetitions without BFR before I throw them into that BFR realm, just because the stress with BFR is a lot more. Okay. So what exercise we're using? A lot of quad sets with the heel propped up, roller underneath of the heel to make sure we can get full range of motion, right? To bend that knee a little bit backwards. Straight leg raise, again, prop under the heel. Long arc quads, internal knee extensions, standing, seated knee bends, and on chair knee bending. Okay. When she came in for physical therapy, we did all of these exercises with BFR as well as neuromuscular electrical stim, because this can help to attenuate the loss of muscle mass. It can also help with that neuromuscular control, getting that quad to fire a bit better. Okay. We also did some strengthening work for the contralateral limb 3 times per week. This was single-legged deadlifts and single-legged squats. Okay. From a conditioning perspective, we end up doing stationary bike by 3 times a week, 20 to 30 minutes with a low to moderate resistance, right? And generally speaking, I give a program, okay, and I see how the knee tolerates it. Are we getting a lot of swelling? Is the swelling going down? Is the range of motion improving? And if all those things are moving forward, then we can advance, right? And advance we did. As she was able to tolerate more and more, we just gave her more and more, right? So this is her strength program. This was her Monday, Wednesday, and Friday. There's only 2 days. So what we end up doing is day 1 was on Monday, day 2 is on Wednesday, and then on Friday you go back to day 1, and the following Monday will be day 2. So just looping between these day 1 and day 2 with a day's rest in between, right? So we're working on goblet squats, split squats, band sidestepping, single-legged deadlifts, seated knee extensions, and ankle weight hamstring curls on day 1. On day 2, kettlebell deadlifts, step-ups with a toe drag, very quad dominant movement, single-legged calf raises off the step, single-legged squats to a bench, sideline hip abduction with an ankle weight, and sissy squats with a terminal knee extension, right? So a lot of quad stuff there. From a PT perspective, when this patient was coming in for physical therapy, like I said, she did once per week. I worked on her range of motion. We did blood flow restriction training. We did neuromuscular electrical stim. We worked on neuromuscular control and balance drills, right? So think about standing on a Bosu ball while someone messes with that Bosu ball and your patient balances on one leg, okay? Drills like that. And then from a conditioning perspective, 3 times a week, we worked up eventually to 45 to 60 minutes, which she was pretty happy about because, like I said before, she loves fitness and this makes her feel like a real person if she can actually do this stuff. So she was very grateful to be able to do that. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain free mini course. Definitely check this out.